Divya Sai, and this is my co-host, Dr. Akash Hinduja. So, we all welcome you all on the behalf of the Department of Pain and Palliative Medicine for coming today for this event of World Hospice and Palliative Care Day.
So, what is this day, Dr. Divya?
So, this is an annual day where we celebrate together in order to support hospice and what palliative care is around the world.
Okay, but why do we need to celebrate this day?
Because with one voice, we celebrate the importance of palliative care in providing quality of life and also the access for palliative care for everyone around the globe.
And what is this year's theme for celebrating this day?
So you can see here, this year's theme is regarding healing hearts and communities.
And why is it so special?
It is special because we have all witnessed COVID-19 pandemic where more than 6 million lives have been lost. There has been a huge strain over the healthcare system and also for the caregivers. And also we have recently witnessed a war in the Ukraine and Russia where there have been a loss of millions of families, caregivers, and their increasing distress. So we can all see that they have had a poor quality of life, relentless strain and burden. We need to acknowledge such situations so that we as palliative care physicians can provide them a difference.
But what has palliative care to do with all this?
So the advocacy of World Palliative Care Day 2022, it includes a call for the nation's strategies so that there is an inclusion of grief and bereavement care, which is essential in giving support for the healing process. So all of this has to be a collective effort, not just from us, from the governments, from the policy makers, thereby recognizing that death, dying and grief, they are not inseparable and all are same. And we as palliative care physicians can provide them a grief and a bereavement support both for adults as well as children. Because everyone has a right to health and our collective efforts will increase awareness that palliative care is a component of right to health and it is based on a philosophy that supports communities to alleviate suffering. అంటే కుటుంబానికి బాధ చనిపోవడమే కాకుండా చనిపోయిన తర్వాత కూడా మనం కేర్ ప్రొవైడ్ చేస్తూ వాళ్ళకు ఒక చేయూతగా ఒక పాలియేటివ్ కేర్ అనేది సపోర్టివ్గా ఉంటుంది అని మనం చెప్పగలం. So Dr. Akash, can you just brief out our history about our center, how we have started palliative care in our hospital and how far we have come today?
So the center is actually committed to the philosophy of continuity of care and non-abandonment. So we started back in August 2018 with a pain clinic, followed by the training in Center for Cancer Care, which was conducted in Jan 2020 session, followed by establishing an exclusive palliative care ward, and then we got the approval of 2 DNB seats. So providing a variety of services such as acute pain crisis, patient control infusion analgesias, interventional pain management, along with allied clinical branches such as Department of Psycho-Oncology with Dr. Tushna Bharia, with the departments of Dr. Physiotherapy and the Department of Dietetics. So throughout the journey of the Department of Pain and Palliative Care, the support from all departments has been immense and consistent. Because of the combined effort, today our hospital has been an ESMO designated center for integrated oncology and palliative care. We are the first designated center in the state of Telangana. Because of the consistent support from the departments of medical oncology, surgical oncology, radiation oncology, we have reached to this pinnacle point. We would like to give a special thanks to our medical director, Dr. T.S. Rao sir and Dr. Basan Kumar sir.
We would like to call the dignitaries on the dais.
We'd like to invite our CEO, Dr. Prabhakar Rao Garu, on the dais.
We would like to call upon our academic director, Dr. Kalpana Raghunath Madam. Please come on the stage.
We'd like to invite the radiation oncologist consultants, Dr. Dilip Kumar sir and Dr. Tasneem ma'am.
We would like to call Dr. Sumati Madam. Madam is the HOD of Yoga and Naturopathy at AdLife. She is a teacher and a practitioner since 20 years. Please come. We would like to call upon the HOD of Pathology, our beloved Radharani Madam. Please come on to the dais. Michael ma'am. We would like to call our nursing superintendent. Madam, please come up on the dais. We would like to call our Pranit sir and Praveen sir, Department of Pain and Palliative Medicine. So now we are having a traditional lamp lighting ceremony as a tribute to our mother Saraswati by our Honorable CEO sir and Kalpana Madam.
పట్టలేసారా ఎవరో ఇల్లంతా
We would like to invite now Dr. Prabhakar Rao Garu to speak a few words on this occasion.
Good afternoon to all of you. Congratulate the entire pain and palliative care team for organizing this on this occasion of World Pain and Palliative Care. We are very proud that our unit is taking care of the poor terminally ill cancer patients by reducing their suffering, which is the most important thing for anybody in the life. The cancer patients, once the treatment, we know that this is the end. When the suffering starts, there the role of the palliative team comes. To reduce the pain and other symptoms, the patients are given the palliative care so that for the rest of their life, they will be comfortable and by reducing the symptoms and pain. I congratulate again once our team for getting the award to the organization. I'm really proud that our team is doing a very good job, excellent job. I say that they should continue and treat more and more patients in future also. Thank you.
I'd like to call our beloved medical director, Kalpana Madam, academics director. Please give us a few words of thought, ma'am.
Hello, dear friends. Already you know why we all assembled here. So the institute started the Department of Pain and Palliative Medicine with Praneeth, Praveen and the team, and we started a DNB program also, and the youngsters have taken up the admissions. It is a very challenging role. The pain and management of pain and palliative care is really challenging because you have to meet the requirements of the patients and also their family members. So management of pain is very difficult. Medicines alone cannot do. The patient, especially those who are suffering with cancer or in the terminal stages, they look for a lot of emotional support. Then question of the pain management, the nutritional support. Everyone thinks pain management is only by simple medication. It is not so. Anyhow, the concerned specialist will go in detail, and especially I have a word for the patients and their attendants. They should take it. This is a part of the management of cancer, which will improve the quality of life of the patient. And also the team provides support to the patients and also their family members. And we should say, bless the team with all the best in the future for taking care of the patients. Thank you.
We would like to invite Dr. Chandra Shekhana sir to speak a few words on this occasion. Department HOD of the Department of Veterinary Surgical Oncology.
Good afternoon to all of you. It's a surprise for me. I was just walking through that and I came here. See, the pain and palliative in the sense, we know that any patient, let it be cancer patient or even otherwise also, when they come to any clinician, our primary responsibility is not just diagnosing the individual and also treatment. The most important responsibility most of the clinicians would forget when we actually treat the patient to relieve the symptoms. I've seen patients come with suppose simple oral cancer, they come with a complaint of pain in the tongue or pain in the oral cavity, you examine, you diagnose, and you ask for investigations. And by the time you start the treatment, it would be at least 2 to 3 days minimum, I would say, even more than that sometimes. So for this 2 to 3 days, are you going to relieve the symptoms of the individuals? Most of the clinicians, I would say most, are missing that part. It is unfortunate that the patient will go out of the clinic and come back and say that, sir, can you give some medication for pain relief? So our prime goal is to relieve the symptoms or relieve the problems of the patient. Then of course you go on to the further treatment details and other things. So this is one important thing which is missing in the clinicians. And I would say that when the patient comes in, as a clinician, one should be able to read their face and the body. Once you read the face and the body, you understand most of the times what exactly the patient is actually suffering from. In the sense, once you read that, then you need to study it. So there is a difference between reading and studying. Reading is just a casual reading. Studying in the sense you need to go in depth and understand what exactly you read it. So that is very important. In the sense, one should be able to understand what exactly the patient is going through. Especially in the cancer, the pain management or palliation for that matter would start from when the patient is registered. Once the patient is registered, you should be able to basically take care of pain and palliative along with the concurrent remaining treatment, which is chemo or radiation or surgery. So especially as I said for cancer patients, because cancer patients, I would say that it would be a long-term follow-up for the individuals, and sometimes unfortunately they recur also. So our aim of any clinicians for that matter, we need to incorporate the principles of pain and palliation from the beginning itself. Palliation means, it doesn't mean that it's only end of life. It's most of the times it is unfortunate that our misconception is we think always palliation means end of life. It's not always. So palliation is to relieve the issues. Let it be social issue also. Sometimes we need to go into the patient's shoes and try to relieve the social issues. I will give you some example. Patient coming to your clinic without any chappal or a wear and torn clothes, can we expect them to give immunotherapy? It is not. Even if the patient is indicated for it, you can't. Because we need to look for their social factors also and try to address accordingly. So where your intelligence as well as your wiseness will come into play. So that is the way one should really look for it. And congratulate our pain and palliative treatment, because they are specialists in our hospital. And for that matter, any patient who is not relieved of the pain or issues by a simple medication which would be given by us, generally we give a simple medications. And if that pain or that issue is not resolved, those are the people who are our saviors. Not for us, even for the patients and their family. Because most of the individuals, without a pain control or without the symptom control, the life is hell for them and also their family. We come across, we see that patients would not sleep for days together, and also the family members, which is a problem. So once you relieve the pain, you can see the smile on the patient as well as on the patient's family. Because sometimes we explain the patient's condition like you are going to die in 3-4 months time or 6 months time, or you are not going to be cured. Irrespective of that, if you relieve the symptoms, you can see the smile on their face. So that is very, very important. As a pain and palliative, the principles of any particular physician for that matter, as I said, one should keep these kind of things in the mind while treating any individuals. We are fortunate that these two young our anesthesia colleagues, who are now the pain and palliative colleagues, have taken this challenge, because most of the clinicians would not be happy in taking this kind of challenges. They'll be always happy in treating the patients rather than actually taking this challenge. It is fortunate that these people have taken this branch and taking it further forward. And also we are glad that we have the DNB students with them. So definitely the academics also will improve. Once there are students, we generally don't do mistakes. That's always kind of saying, in a sense, because you will be always scrutinized. 24 hours, you will be always scrutinized by your juniors, so that you don't tend to do mistakes. So these people are doing really wonders. I have seen actually many testimonials were given by the patients and the patient families. So they are really doing a great job. So I would congratulate them, and also I would say that all the best for the team to do further wonders in our hospital. Thank you very much.
Thank you so much for your kind words, sir.
With all your immense support, we were able to achieve all of this, sir. Hearty thank you for all of you. Now I would like to call upon Dr. Radharani Madam, Department of Microbiology. Please.
Good afternoon, everyone. It's really come as a surprise to me, because I just came for the inaugural function. So I would first like to congratulate the Palliative Care Department for taking this initiative and conducting this program. I would just like to say one thing, that cancer therapy is incomplete without the Palliative Care Department and the palliative care procedures. Because this is one area where the patient and the patient attenders, especially the patient's family, it is very important for them to explain to them the end stage. I'm not a clinician as such, but I think as a human being, I can understand the difficulties what they go through, especially when they are in the end stage. So I would like to thank everyone, and thank you for giving me the opportunity to be a part of this program.
Now I would like to call upon Dr. Sumiti Madam, HOD of Yoga and Naturopathy, to give us some insights.
I congratulate Palliative and Pain Department
starting this and making us part of this program. Since patients need a lot of counseling and then natural procedures and support for them, so we are also made a part of these programs. And Dr. Praneeth and Dr. Praveen are referring cases to the naturopathy and yoga department to relieve the stress for them, and the diet prescriptions and some of the naturopathy treatments which can give a temporary relief, like instead of analgesics and all, we have lot of hot and cold treatments and all. So we are also supporting them with that. So patients are satisfied with the treatments. So with that regard, I would like to give some of the health tips, like following the diet which is good for them when they are in need the nutritional support. And apart from that, some of the yoga techniques, yoga and pranayama, which improves their immunity, and that also I would like to give a brief tips on that. Apart from that, and the naturopathy treatments. So generally, what we have to do in the cancer cases, diet is the main thing. Generally, lifestyle changes are the major one which is causing the disease. When we are not following the diet or regular lifestyle, we are away from that, then we are prone to get the diseases. So when we follow to correct that, we have to follow the diet also. Already who has affected the cancer, if they follow certain diet principles, it will be good. That is changes in the diet. Aharanlo marpulu. I think all of you can understand Telugu, or you want me to explain in English also. Most of the antioxidant diets which are good for the health is more important, like more of containing the vitamins and minerals one. And fiber content is more important in the diet, and that is available in fruits and vegetables. Especially who are with the rural background, they don't get the fruits more, and even local seasonal fruits are very good, which people are not understanding. Nowadays, they're trying to follow that. And then smoking and alcohol, tobacco, all these things are quite common in villages and rural areas. That and personal hygiene, వ్యక్తిగత పరిశుభ్రత, దురలవాట్లు. తర్వాత కుకింగ్లో యూజ్ చేస్తున్న మాడిన పదార్థాలు తినడం, ఇవన్నీ కూడా క్యాన్సర్కి కారణాలు అవుతున్నాయి. ఆయిల్, జనరల్గా పిండి వంటల్లో వాడే ఆయిల్ ఎక్కువ సార్లు మనం అంటే రోడ్ సైడ్ ఫుడ్స్ తీసుకున్నప్పుడు కూడా లాట్ ఆఫ్ ఆయిల్ రిపీటెడ్గా వాళ్ళు కుక్ చేస్తూ ఉంటారు. సో ఆయిల్ ఎక్కువ సార్లు యూజ్ చేయడం వల్ల కూడా వస్తుంది. ఈవెన్ మనం ఇంట్లో కూడా ఒకసారి చేసినది యూజ్ చేయకుండా ఉంటే బెటర్. ఎక్కువ క్వాంటిటీ తీసుకున్నప్పుడు తర్వాత యూ కెన్ యూజ్ ఇట్ ఫర్ ద కర్రీస్, కూరల్లో వాడేసేసి తీసేస్తే మంచిది. అది కూడా దట్ ఈస్ ఆల్సో కాజింగ్ ద క్యాన్సరస్ థింగ్. అండ్ కూరగాయలు, పండ్లు, వీటిల్లో రసాయనాలు, కెమికల్స్ ఎక్కువ యూజ్ చేయటం వలన కూడా, అంటే స్ప్రే ఉండటం వాటి వలన కూడా ఎక్కువగా వస్తుంది. సో తరోగా వాటిని వాష్ చేయటం, వేడి నీళ్ళల్లో కడగటం, సాల్ట్ అది వేసి కడిగి తీసుకోవటం మంచిది. మందులు, కూరగాయలు ఇవన్నీ కూడా. Balanced diet is more important for the patient and even for the in preventive aspect also. So ఇవి మన ఫుడ్లో కావాల్సిన మెయిన్ పిండి పదార్థాలు, అంటే కార్బోహైడ్రేట్స్. దానిలో మనం యూజ్ చేసేది రైస్, చపాతీ, ఇవి రెండే కామన్ డైట్స్ అనుకుంటాము. బట్ దట్ లాట్ ఆఫ్ అంటే ఉన్నాయి. వాటిల్లో చిరుధాన్యాలు అంటారు, ఇప్పుడు మిల్లెట్స్, అవన్నీ కూడా హై ఫైబర్ కంటెంట్. సో వాటిని యూజ్ చేసినట్లయితే కార్బ్స్ కొంతవరకు తగ్గించుకొని ఫైబర్ కంటెంట్ ఎక్కువగా ఉన్న డైట్ యూజ్ చేయడం చాలా మంచిది. మాంసకృతులు అంటే ప్రోటీన్స్లో కూడా చాలా వెరైటీస్ ఉంటాయి. పొట్టి మనం యూజ్ చేసేది కందిపప్పు ఒకటే కాదు, లాట్ ఆఫ్ బీన్స్ వెరైటీస్, సోయా, ఆల్ దీస్ థింగ్స్ విల్ help in preventing the cancer and to protect also, protecting foods. Fats is minimum requirement is there, and the vitamins, minerals, ఇవి రెండు కూడా కూరగాయలు, పండ్లు, వీటిల్లో ఎక్కువగా ఉంటాయి. సో లాట్ ఆఫ్ ఫ్రూట్స్ అండ్ వెజిటబుల్స్ ఎక్కువగా తీసుకోవాలి. జనరల్గా క్యాన్సర్ వచ్చిన తర్వాత ఒట్టి ప్రోటీన్ పౌడర్స్ మీద, లేకపోతే సింపుల్ ఒట్టి రైస్ సాఫ్ట్గా తీసుకోవటం ఇలా ఎక్కువ చేస్తున్నారు.
అలా కాకుండా ఫైబర్ కంటెంట్ ఉన్న ఫుడ్స్, ఫ్రూట్స్, వెజిటబుల్స్ ఎక్కువగా యూజ్ చేయడం అనేది చాలా ఇంపార్టెంట్. వాటిలో రైస్లో లైక్ బ్రౌన్ రైస్ ఆర్ పౌండెడ్ రైస్ అంటారు, దంపుడు బియ్యం అండ్ చిరుధాన్యాలు, వీటిలో ఫైబర్ కంటెంట్ ఎక్కువగా ఉంటుంది. దీనివల్ల ఎక్కువగా గ్యాస్ట్రో ఇంటెస్టైనల్ క్యాన్సర్స్లో ఫైబర్ కంటెంట్ ఎక్కువగా ఉన్నట్లయితే వాటిలో ఎనీ క్యాన్సర్స్ లైక్ ఫైబర్ కంటెంట్ ఎక్కువగా ఉన్న ఫుడ్ తీసుకున్నట్లయితే మోషన్ ఫ్రీగా అవ్వడం, డైజెషన్ ప్రాబ్లమ్స్ లేకుండా ఉంటాయి. తర్వాత నట్స్ అంటే ఏంటూ బాదం కానీ, పిస్తా, అక్రోట్ అవన్నీ. Maybe people think that it is expensive, but when we are spending for the other items, when you compare with that, nuts are not expensive. అవి రాత్రిపూట నానబెట్టి మార్నింగ్ తీసుకున్నట్లయితే దే ఫీల్ మోర్ ఎనర్జెటిక్, అంటే కొంచెం ఎనర్జీ బాగా వస్తుంది. ఎస్పెషల్లీ క్యాన్సర్ పేషెంట్స్లో మార్నింగ్ ఎర్లీ మార్నింగ్ మీరు అది నానబెట్టి పొద్దున్నే ఇచ్చినట్లయితే ఆర్ మిల్క్తో కలిపి గ్రైండ్ చేసి మిల్క్తో, ఒకవేళ సాలిడ్స్ తీసుకోలేకపోతే అంటే గ్రైండ్ చేసి మిల్క్తో పాటు ఇచ్చినట్లయితే వాటి వల్ల ఎక్కువ వరకు ఎనర్జీ బాగా ఉంటుంది వాళ్ళకి. తర్వాత బీన్స్ యాజ్ ఎ సోయా, అదర్ బీన్స్ వెరైటీస్ కూడా బాయిల్డ్ ఫామ్లో కొంచెం తీసుకున్నట్లయితే హై ప్రోటీన్ డైట్స్ కూడా వాళ్ళకి చాలా యూస్ఫుల్గా ఉంటాయి. అలాగే మష్రూమ్ ఒకటి, పన్నీరు, ఇవన్నీ కూడా మంచివి, వాళ్ళకి సాఫ్ట్గా ఉంటాయి, వాళ్ళు ఫుడ్ ఈజీగా తీసుకోగలుగుతారు. అపార్ట్ ఫ్రమ్ దట్ కూరగాయలు వీటిలో ఉండే ఈ క్యాన్సర్స్ని చాలా ప్రివెంట్ చేస్తాయి. మోర్ ఆఫ్ బీన్స్ వెరైటీస్ ఆఫ్ వెజిటబుల్స్, బీన్స్ కానీ, చిక్కుడు, గోరు చిక్కుడు, ఇవన్నీ కూడా లోకల్ మనకి ఈజీగా అవైలబుల్ ఉంటున్నాయి. బట్ కూరలు ఎక్కువగా తీసుకోవట్లేదు. కూరలు కొంచెం వాటి మీద కాన్సన్ట్రేట్ చేసి తీసుకున్నట్లయితే ఫైబర్ కంటెంట్ ఉన్న ఫుడ్స్, సో వీటిని చాలా వరకు క్యాన్సర్స్ని ప్రివెంట్ చేయడానికి ఉపయోగపడతాయి. అదే కాకుండా మనం రెగ్యులర్గా యూజ్ చేసే వాటిలో వెల్లుల్లి ఒకటి, పసుపు, ఇవన్నీ కూడా యాంటీ క్యాన్సరస్ డైట్స్. దెన్ తులసి, పుదీనా, ఇవన్నీ కూడా అంటే ఎక్కువగా యూజ్ చేయడం వల్ల వాటిలో మనం చాలా వరకు ఫుడ్స్లో యాంటీ క్యాన్సరస్ డైట్స్గా మనకి ఉంటాయి. వీటిల్లో ఉండే హార్మోన్స్ని అంటే ఇవన్నీ కూడా మన స్ట్రెస్ లెవెల్స్ని తగ్గించడానికి ఉపయోగపడతాయి. These are the fruits and vegetables. When colorful fruits and vegetables, when we use that, we get lot of vitamins, minerals and in that, and which improves the immunity of the body. Yeah, tulasi is also anti-cancerous, and pudina, ginger. ఇవి ఎస్పెషల్లీ కోవిడ్ టైంలో ఎక్కువ యూజ్ చేయడం వల్ల రెస్పిరేటరీ ప్రాబ్లమ్స్ కూడా జింజర్ ఒకటి, ధనియాలు, కొత్తిమీర, తర్వాత దాల్చిన చెక్క, ఇవన్నీ కూడా ఈవెన్ క్యాన్సరస్లోనూ పనికొస్తాయి. వీటిలోనూ కూడా అంటే మన లంగ్స్ క్లియర్ అవడానికి, ఆక్సిజన్ సప్లై బాగుండడానికి వాటికి ఉపయోగపడతాయి. As I said, nuts, lot of varieties of beans, and wheat grass. Wheat grass is one of the major one, which will improve the blood count. Generally, chemotherapy తీసుకునేటప్పుడు blood counts తగ్గుతూ ఉంటాయి. So that has got the chlorophyll, which improves the blood, hemoglobin levels improve అవుతాయి. సో గోధుమ నారు రెగ్యులర్గా మనం ఇంట్లో చేసుకోవచ్చు. కొంచెం కుండీల్లో పెంచుకొని ఒక 2 to 3 inches పెరిగిన తర్వాత దాన్ని తీసి జస్ట్ ఒక 1 ounce ఎవ్రీడే తీసుకున్నట్లయితే వాళ్ళ హిమోగ్లోబిన్ లెవెల్స్ పెరుగుతాయి. సో ఇట్స్ ఈజీ. దీస్ ఆల్ ఆర్ సింపుల్ అండ్ ఈజీ ప్రొసీజర్స్ అట్ హోమ్ వేర్ వీ కెన్ ఫాలో. ఇట్స్ జనరల్ డైట్ లైక్ డైట్ ఫర్ క్యాన్సర్ పేషెంట్స్. మార్నింగ్ వాటర్ ఈజ్ ఆల్సో వెరీ ఇంపార్టెంట్ because water is also very important, and then taking lot of juices. Ashgard juice is very important, which gives the relief for the acidity అలాంటి తగ్గించడానికి ashgard juice ఒకటి బాగా ఉపయోగపడుతుంది. సో ఉసిరి, వైటమిన్ సి ఎక్కువగా ఉంటుంది. సో డైట్స్, I think they will give you the diet procedures after the patients. Later we can give these diet charts. And yoga is very important, which will improve the oxygen to the body and cell functioning బాగుండడానికి ఉపయోగపడుతుంది. ఎస్పెషల్లీ ఫిజికల్ ఎక్సర్సైజెస్ ఏదైనా చేయొచ్చు, బట్ యోగా ఒకటి మంచిది. ప్రాణాయామము, లిమిటెడ్ ఎక్సర్సైజెస్ ఆఫ్ సమ్ ఆఫ్ ద ఎక్సర్సైజెస్ లైక్ పవన్ ముక్తా సిరీస్ అంటారు, విచ్ విల్ ఇంప్రూవ్ ద మొబిలిటీ అండ్ ఫ్లెక్సిబిలిటీ ఆఫ్ ద బాడీ. simple exercises even for the cancer patients, whatever stage they are. If they do little movements, it will improve the digestion, improve the flexibility, and they feel little active for that. As digestion improve avutundi, blood circulation improve avutundi, and because of the exercises, all internal organs also will be supplied well with doing the yoga. These are some of the exercises, simple exercises where you can follow. Even the sitting on the bed, easily they can do, and they feel little active. Just limbs movements and then these things. Pranayama especially, alternate breathing and simple pranayama techniques will improve their immunity, and regular following of just for 5 to 10 minutes, even if they do pranayama morning and evening, definitely they'll have lot of strength and they improve very well. And naturopathy treatments low, especially constipation and diarrhea is quite common for them when they are on medication and doing the things. Like constipation can be removed with the following the fibrous diets, taking lot of water. And apart from that, we have mud treatments, mud packs, which is available, or wet packs on the abdomen will remove the heat from the body and improves the circulation, and they will be able to have get rid of those constipation. And diarrhea, it's a simple thing. With ice cold water, ice packs, when you wrap around the abdomen, it can be immediately give relief for the diarrhea one. Even vomitings also, ice massage to the back of the neck will reduce the vomiting sensation. These all are the simple techniques which can follow it at home and do these things. These are the treatments. So keeping them cool and making their body light with the fibrous diet and nutritious diet, and more of vitamins and minerals diet can keep them light. And for meditation and pranayama techniques can give the mental peace. And for pranayama again, it's breathing can be improved, and like relaxation also can be given for them. Yeah, these are the diets. More of millets and pulses and all. Beans, badam and pista is also good for improving the immunity. Flax seeds and pumpkin seeds are also good to a lot of. It has got the anti-cancerous things. And lot of vitamin C, colorful fruits and vegetables will give them the immunity, and they get stress relieved. Thank you.
Thank you, ma'am. Thank you for such an elaborate presentation. Now we would like. So our palliative care is incomplete without our nurses. So we'd like to welcome our nursing superintendent, Dr. Srivani Garu, to please speak a few words on this occasion. Please, ma'am. Just a few words.
Good afternoon, all of you, sir. Sir, given an opportunity to speak some. Congratulations, first of all, palliative care unit. Nursing is important role in palliative pain and palliative care unit. Our nurses are doing especially comprehensive care, foot to head care is giving as mentally, physically, socially and spiritually. Our nurses are doing best care, I think so. What, sir? Pranit sir, are you agree? Yes, our nursing team is doing very good job, I think so. For starting palliative care in that, Rajesh and then Blessing posted in OPD, and some of nurses are doing very good job. Congratulations, my nurses as a Rajesh. They are doing continued duties 24 hours. Sometimes palliative attendants also saying to me, your nurses are doing very good job, ma'am. They are giving very good support to we are in a sad moment and all. So I'm proud to say our nurses are doing very good job in that time. I'm proud to say that my nurses are still more, they want to do for more support to the nurses, patients and family members especially. Palliative means the family members are approaching many doubts and many supporting they are asking. Still more requirement for my side I will give for support to patient and family members. I will give a support to end of this services. Thank you.